I could be watching American Idol, but no. I'm doing a Gobbet of Pus number 85. It's back from December 31st, 2008. I have determined through long observation that the use of intravenous heroin is not conducive to a healthy lifestyle, which I need. A lifestyle, that is. I have a life, but I seem to lack a lifestyle. Of course, I wore bell-bottom cords well into my 30s, so perhaps I have the style known as dork. There are a few infections that are 100% fatal in humans. Rabies is one. Another is bacterial endocarditis. If you do not treat it correctly, it will always kill the patient, always. The closest I have ever come to a spontaneous cure was a patient who came in with streptococcal endocarditis, received 2 doses of ceftriaxone, and then remembered he was a Christian Scientist and refused further therapy. He survived, and he came back a month later disease-free, giving credit to the big scientist. But I still think it was the 2 doses of the long antibiotic that got rid of his endocarditis. The problem is that if you want heroin, you may not hang around to get your antibiotics, especially if the doctors have been kind enough to give you direct access to the central veins of your body for easy delivery of antibiotics. So the patient today, staph on the aortic valve, rather than stay in the nursing home, she skipped to get some drugs and relapsed her infection. Back to square one. I emphasize the universally fatal nature of her disease, so perhaps this time she will complete therapy, this time with some drug rehab thrown in. But if the past behavior predicts the future, I am not optimistic she will survive. I have read somewhere, but cannot find where, that the average IV drug user in New York City lives for 5 years and dies of either murder or infection. Like I say, not a healthy lifestyle. The worst case of endocarditis was that of Alfred S. Reinhardt, who developed his heart infection as a result of rheumatic heart disease and had the double misfortune of being both a medical student and developing his disease in the pre-antibiotic era. As such, he had insight into all the detail of his disease and could recognize and predict his future. He kept a diary of his disease progression until a few days before he died, and it is one of the saddest of all medical writings. I don't worry too much about being dead, but the process of getting there has never appeared to be all that pleasant. When he developed the embolic events that characterized the disease, he was with his sister-in-law, and he told her, "I shall be dead in 6 months." Alfred S. Reinhardt saw the bullet coming for months, Matrix style. Ugh. Quote, "I felt sure I was going to collapse momentarily from sheer exhaustion induced by lack of sleep and the intense pain. I cannot deny that I had visions of the end. Nevertheless, I knew that morphine would soon take the edge off my pain. Standing orders permitted me to call for reasonable doses of morphine within proper limits of time as I should find it necessary. Proved a great boon in these days. I utilized this privilege comparatively little in the past, but was only too ready to ask for 1/4 of morphine at this time to relieve the intense distress that was gripping me. The dose seemed to take the edge off the pain sufficiently to allow me to lie on my right side for perhaps 10 or 15 minutes, during which time I readily fall to sleep, following the exhausting experiences of the past hours." End quote. He was soon dead at age 24 after experiencing a stroke from acute heart failure. If you think you are having a bad day, read about Mr. Reinhardt. You can find his diaries by Googling Reinhardt endocarditis, and they're available in the Canadian Medical Association Journal. Every time I read it, I get all bummed out. I think, rather than American Idol, I'm going to go listen to The Cure. And I misnumbered this podcast at the beginning. This is actually podcast 85. Yet another Gobbet opus. And don't forget the Persiflager's Annotated Compendium to Infectious Disease Facts, Dogma, and Opinion, available as an iTunes app. Yes, there's an app for me, because the world needs more Mark Crislip.